Sandra, and tonight I'll be speaking to you about the respiratory system, and we start with the anatomy and physiology. The main purpose for the respiratory system is for inspiration and expiration, which is the same thing as taking in oxygen and taking out carbon dioxide. We start with the nasal cavities, which is made up of two membranes, and those contain mucus, which trap bacteria and other irritants so they don't get into your lungs. The membranes also contain cilia, which push the mucus downwards to your stomach. And then we move on to the pharynx, which is a pathway for your food and air to enter through your lungs, and it contains skeletal and involuntary muscles so that it can help you swallow. You can initiate the swallow yourself, but once you take it out the whole gulp, those muscles will help guide the substances into the right direction. We have the larynx, which is also called the voice box because it contains the vocal cords there. When air passes through the larynx, the vocal cords vibrate along the way. And then we have the epiglottis, which is a small flap of cartilage that, when positioned normally, it allows air to pass through the larynx. But when you eat or swallow, the flap closes so that food can get through the digestive system. Finally, have the trachea. While its back is composed of smooth muscle, the rest of the walls are contained of stiff rings of cartilage, which prevent the trachea from collapsing if there's too much weight pulled on your chest, and it also contains cilia, which moves the mucus upwards. So when you have too much mucus stuck in your lungs or your respiratory tract, you just cough it up. We have the lower respiratory tract, which is composed of the lungs. The left lung is smaller than the right lung, and this is to accommodate the left ventricle of your heart. And it has 2 lobes as opposed to right's 3. And then we move on into a pleural sac, which is composed of 2 membranes that contain a fluid which helps them slide past easily each other, and therefore your chest and muscles can expand easily as well. The bronchi, which directs incoming air specifically into the lungs. When that air enters, it branches smaller and smaller into smaller bronchi, and this branching is called the bronchial tree. Alveoli are tiny air sacs that make up most of the tissues of your lungs. With the help of capillaries, they perform gas exchange in which carbon dioxide and oxygen are swapped in your red blood cells so that the oxygen can make good use in your red blood cells. Then you have the diaphragm, which is a sheet of muscle in a dome-shaped like structure. When it contracts, there's increased space inside of the thoracic cavity and decreased pressure in the lungs. When it relaxes, there's now increased pressure in the lungs, and it restores its normal shape. System conditions, they can fall under chronic diseases or viruses. The first of them is asthma, in which the airways become very narrow and start producing extra mucus due to the person being triggered. These triggers can include dust, pollen, or can come from inside of the immune system due to stress or other hormonal changes. They can also be considered reactive airways since the person's bronchi are so sensitive, and when these airways become inflamed for no reason, the person basically has an asthma attack. Symptoms include coughing, wheezing, or sneezing. Treatments can include inhalers or allergy shots. Bronchitis, as the name suggests, is an inflammation of the bronchi, and it can either be acute or chronic bronchitis. While acute bronchitis can arise from something simple such as a cold or breathing in a lot of cold air, chronic bronchitis can be much worse as the cells of the bronchi and the cilia have been damaged. This means that the cilia can't move mucus out or the irritants out, which means that the more you cough, the more the bronchial walls get damaged and the more mucus and swelling build up. For chronic bronchitis, you can benefit from pulmonary rehabilitation, and it is caused by pollution or fumes. And for acute bronchitis, its treatments can be antibiotics. Pneumonia is an infection that affects the alveoli of the lungs and can be bacterial, viral, or caused by a fungus, and in turn, these infections can cause inflammations of the lungs or the alveoli to swell with fluid. This is possible through the breathing of an infectious organism or being hospitalized. Risk factors can include a weakened immune system or chronic disease, and symptoms can include muscle aches, shortness of breath, chest pain, among coughing, and fever. Emphysema affects those who have had a long-term exposure to some kind of irritant, and while it can be caused by inhaling chemicals or substances, its main leading cause is smoking. One of the main outcomes is that the walls of the alveoli become damaged, so the amount of area available for gas exchange becomes reduced. Another outcome is that the tissues of the lung become damaged, so it's replaced by rigid tissue, which becomes harder to receive air. Although it cannot be cured, the best way to prevent emphysema is to clean the air in your environment. The model I'll be showing today is based off the process of inspiration and expiration as shown in here, in which the straws are the tracheas, the small balloons are the lungs, and the bottom part of the balloon here is the diaphragm, and it works like this. The main similarity between this and the actual respiratory system is that it actually shows the process in which when the diaphragm contracts, it pulls downward and the lungs expand outward, and when the diaphragm relaxes, it retains back into its dome shape and the lungs return back to normal as well. The main contrast between this and the actual respiratory system itself is that breathing is actually controlled by the autonomic nervous system, which means you can't control it yourself like here.